Dr. Solomon told me that it's better to do an endoscopic brow lift, to just lift the brows and change the brow positioning, and it'll open up my eyes naturally.
Many patients, an endoscopic brow lift or an open brow lift will reposition the brow and kill two birds with one stone. It'll move the brow up.
How will this procedure, I mean, she's 36. How will she age with this?
The only sort of pitfall is in lean young women is whether they have enough fat to use for the procedure.
Her results are perfect. Yeah. She just really looks, everything's flawless.
Well, you look great, and you don't look
just
like
so good.
you don't look overly elevated, and you look
But that's
natural.
also why I came to you, because I knew your expertise and I know your work, and just knowing that anything that you would have done to my face, it's going to be done properly, and because you're a surgical god. But it's people. But
we're gonna have you on every week. Hi everyone, welcome back to Unfiltered. Today we're going to be introducing a patient who's in her 30s, who's gorgeous, but was noticing some early changes of the aging process. She's super athletic. I'll let her describe her regular routine, but it's interesting. And she started noticing some of the signs of aging, probably accelerated a little bit from her lifestyle. And we performed a endoscopic brow lift as well as facial fat grafting. And I'll let Nancy introduce her as well, and then we can chat through sort of what you were looking for and what your objectives were, and how the surgery, whether it helped you out.
perfect.
All right. Hi, everyone. So this is Rachel, and I'm Nancy, and today we're going to talk about early signs of aging. So the aging process actually begins anywhere between the ages of 25 to 35. Well, the aging process is always going on, but noticeable signs of aging can happen in that range. And Rachel came to us probably at the end of that range, about the age of 35. Is that right?
36.
36. So she came to us because she was noticing, I guess your under eyes were looking a little bit more hollowed and crepey. That was bothering you.
Yeah, so the issue with my eyes that I was seeing over time was that there was a textural issue underneath my eyes. There was crepiness going on my eyelids, and I just looked tired all the time. And I was doing a bunch of other procedures to try to correct it, but I knew at a certain point, I think a surgical procedure just would have made it a lot better. And that's when I came to Dr. Solomon and inquired about, well, at first I inquired about blepharoplasty because I saw all these things on TikTok, and me thinking I'm a surgeon going into a consultation. Dr. Solomon and told me that it's better to do an endoscopic brow lift, to just lift the brows and change the brow positioning, and it'll open up my eyes naturally. And the results have been incredible.
I'm going to show her before picture. I brought it with us. So here you can see. So Dr. Solomon, you want to describe?
Yeah, so pretty much we're talking about the periorbital area above and below the eyelids. And pretty much in every case, we look at the anatomy of the eyebrow, whether there's some fullness around the orbital bone. And then we look on the eyelid itself. And there's often some crowding and what we call hooding of the skin of the eyelid. And then we move down to the lower lid, where there's three things that can happen. Some changes to the skin called dermatochalasis. There could be some change in volume, where you get volume loss and a prominent tear trough. And also you can get bags forming that are protruding out, causing puffiness to the lower lid. So we have to sort of look at all of those and then make a decision what in each case is best option. Many patients, an endoscopic brow lift or an open brow lift will reposition the brow and kill two birds with one stone. It'll move the brow up, reduce the hooding of the area below the eyebrow but above the eyelid itself, as well as clean up the skin on the eyelid. In some cases, patients who are a little bit older may need a combination of a blepharoplasty combined with a brow lift, but we sometimes just play around in the office. I think we sort of toyed around with your brows and you sort of liked what you saw. So some people's anatomy is ideal for it, and Rachel's anatomy, I thought, would do well with it. So we elected to perform that, combined with some resurfacing of the fine lines under her eyes, and then some volumization with fat grafting. And, with fat grafting, it's a terrific technique. The only sort of pitfall is in lean young women is whether they have enough fat to use for the procedure. And because Rachel's an ultra marathon
runner,
which we want to talk about too, because it's super cool.
Yeah, so with the ultra marathon runners, you just worry, will you have enough fat? So I knew there would be no fat on her abdominal wall, but I thought
Where did
there'd
you find
be
fat?
some in her lateral or medial thighs.
Yeah, I was like, ooh. When the next morning, I'm like, that was spicy. It was like out on the outer quad.
thighs.
Yeah.
Yeah, so you didn't have tons, but for the eyes, we don't need
Yeah.
too much. We need anywhere like about 10 cc's of good fats. We have to harvest usually about 15 to 20 because there's fluid and other stuff mixed in, and then we put it through a purification process, and then we put it through almost like a strainer to thin out to make it like micro or nano fat, so it's not lumpy and it's very smooth, and then we inject it to sort of volumize the area. So I think it was
Her results are perfect.
Yeah.
She just really looks, everything's flawless.
well, you look great, and you don't look
just
like
so
you had
good.
you don't look
Anything done.
overly elevated, and you look.
But that's also why I
natural.
came to you, because I knew your expertise and I know your work, and just knowing that anything that you would have done to my face, it's going to be done properly, and because you're a surgical god. But it's people, but
We're gonna have you on every week.
no, but I mean, I have people coming up to me, they're just like, you look refreshed. Like, what did you have done? And that's kind of the point. It's like, it was for me 100% because it was what I saw in the mirror every single day. Like, I'm like, oh, my eyes. But then when you have people coming up to you and saying like you look amazing, but they can't pinpoint what it is. And like, that's a testament to the surgeon of just doing work that is conservative. It's really well done, not overly, I see this stuff on TikTok, and I see some of the procedures that are potentially done overseas, and everything is just pulled and it's exaggerated. And it's like, how is that going to age in like 10, 15 years? So it's about finding a great surgeon, doing your due diligence, doing the research on the procedure, and then having trust in your surgeon. So thank you so much for this.
You're very welcome. And I appreciate all your kind words, and honestly, that makes you feel great. Makes me feel great that you're happy with the surgical outcome. So thank you, and thanks for putting your trust in me.
Of course. Always.
So how will this procedure, I mean, she's 36. How will she age with this? So let's say in 10 years, I mean, the aging process continues, as we know.
Everyone's different. I mean, there's genetics, there's lifestyle factors. None of the procedures are permanent, but they're restorative. So we've reset the clock, and then we'll just have to see. Ultramarathon runnings, I don't know how many years. Well, you tell us about ultramarathon
I want to
running.
talk
How many
about
years
that.
do people participate in that sport? What's the age
And what is it?
demographic? And yeah,
So ultra marathons are any distance over a marathon. So that could even be like 45K, but the distance.
An average marathon is
42K.
42K. So anything above that is considered
anything you could
ultra.
do like 43K, and that's a ultra marathon. But what I do is trail, mountain. So my distance is between 80 to 100K, but it's in the
almost
mountain.
double.
Yes, but in the mountains,
that's
and not
crazy.
flat on the trail in the middle of, I could be in the Alps, I could be in Patagonia. So it's also, my skin is taking a lot more of the elements of being outdoors, of being like in harsh conditions. And so, I mean, it's a great sport. I completely love it. And I feel like the longevity of the sport, people are running up until their 60s, 70s. It's amazing. And I feel like the older you get, the longer in distance you go. And, I have so many friends who are now competing in these 200 to 300 mile races across like the US. And I can't even conceptualize running for that long, because it's like a 5 to 6 day race, but it's amazing what like the mind and body can do, and just like what you gain out of it, like mentally, physically, emotionally. So
We were chatting.
quite impressive.
It's so impressive. We were chatting before the taping today, and you said that you can go 13 hours climbing in mountains.
Yeah, my last race,
Yeah.
I did it in
13
13
hours.
hours.
With just how long are the breaks?
Well, I mean, if you want to do well or do relatively well, like you need to time your stops at the aid station very quickly. Just like quickly fill up your water bottle, maybe grab some snacks.
It's amazing.
But it's just like a constant sport of eating, which is also great, because like all the aid stations are like, the worst type of foods, but you need those like white refined foods. So it's like you have chips, pretzels, white bread, like it's great because you need it, because you're in such a calorie deficit for the whole race. So you get to an aid station, you're like in like this utopia of like snacks, which is fantastic. But yeah, I mean, depending on the distance, you're out there for a while.
It's amazing.
So you start in the morning, you're back for dinner, and call it a day.
That's great. How does running affect the aging process? Because I do know that it can.
Well,
deplete the collagen.
anecdotally,
Yeah.
and I think most physicians who do aesthetic medicine would agree that the running can cause some facial wasting. So Rachel's lucky she doesn't really
She looks
have
beautiful.
It,
Doesn't look like it at all. You look unaffected.
Yeah,
I've tried
really-
to maintain my
Yeah.
skin and the plumpness just over the years as I've been running, because I've seen it in even some of my girlfriends. It's just like there is like wear and tear to the skin and then laxity and stuff, which is completely fine. I mean, it's a sport, but I also just want to maintain the integrity of my skin. And I think when I got into my 30s, I really started educating myself on proper skincare, medical grade skincare, and then I just started implementing that into just a holistic form of just like between running and taking in self-care. Like that's what
you
it
have to
is.
find a balance.
Yeah,
for sure.
sure.
And there are some other things that patients can do. Some of the biggest things would be volumizers. So fat to me is the best if patients have fat. Then there's filler, and then there's biostimulant. So combinations of all of those can be used just to maintain volume, and you can implement them as time goes on, just depending on where you're on. So on the aging process and whether your volume is being reduced from just facial wasting or atrophy from just burning so many calories with your running. So, but so far right now you're doing everything right. So you're maintaining your sport and you're maintaining your looks.
Mm-hmm.
But I think there has to be for me, it's about balance, right? Like I can be super rugged and I don't mind coming back with like bugs in my hair and just dirt everywhere. But on the flip side, there's self-care too. And just, I think it's a balancing act, which is just harmonious.
Any other questions? I feel like we covered it. I feel like we covered a lot.
Okay,
I can talk about it.
To give context.
Yeah.
And you can shut me down at any point because you are the surgical god. So I follow this girl on TikTok. I'm obsessed with her, very transparent about every single procedure she's done. And her issue, everything looks great. It's just like, I guess what, like to your point of like that it's animation of like when I smile, there's still like this like jelly roll. Right. But then I think if she had gotten the procedure of a skin pinch.
Right.
But like, I know a lot of surgeons don't do it, some do it, like, and I don't know, like, what the best course of action, or don't touch it, don't do
I was gonna
anything.
say, at what point do you just leave
It's just
well
like
enough
there's
alone?
I think you don't want to make the decision on skin excision based on dynamic animation and dynamic movement. If you're at rest and you're seeing some roll there, then it's probably redundant skin. And we try to use energy devices and lasers as much as possible to deal with the, as we said, dermatochalasis, or the changes to the skin under the eyes. Yeah. But in some cases, it's not enough. Some people do more than one treatment with the laser. Lasers, some people try to make a calculation. What does one CO2 laser compare to in terms of skin excision? And some people think it's like removing a few millimeters of skin each time you do a CO2 laser. So why not do skin excision? Aside from the incision and the scar that comes with it, that's not really the reason not to remove skin. The main reason is that it can change the shape of the eye. It can have a little bit of a dynamic pull down.
Yeah.
And so whenever you're removing skin underneath the eye, if someone's got tons of skin, the eye position should stay the same. Sometimes we have to put in deep sutures to hold the eye up to avoid the pull down of gravity, and you get away with it. 30% of patients who get skin removal type of blepharoplasty, if you look super closely at their anatomy, there'll be some super subtle changes in their amount of what's called scleral show, the amount of white of their eye that shows. Yeah. So most oculoplastic surgeons, facial plastic surgeons, and plastic surgeons in the main who do a lot of blepharoplasties will offer combination treatments, either transconjunctival, which is from the inside, which we do for bags, but not take any skin and then laser resurface the skin. If that's not adequate, they may do a tiny, tiny bit of skin pinch. And then if someone's got significant changes to the anatomy and architecture of the muscle, they may do what's called a skin muscle flap, where it's more than a pinch. You're actually lifting the muscle up to a higher position and then trimming the skin at that time. So there's multiple different procedures of blepharoplasty that can be done.
Yeah.
Someone like you who looks so good with adding the volume in the laser at rest, your risk-benefit ratio sort of has to be assessed. So I would say wait till it gets a little bit worse, like with time, and keep it in your pocket as one of the possible treatments that we could utilize in the future. But I wouldn't rush to doing a skin pinch just because when you do a big smile, there's a bit of bunching up. Even a baby would have that, So you have to use your
Again,
judgment
this is
on it.
why You are my surgeon.
You're so
Oh,
sweet.
educated one.
Yeah.
So smart and amazing.
You're so kind.
I was just going to say that we did some consultations today, and somebody that I spoke to was talking about lower blepharoplasty, and they had gone to 2 other surgeons for consultations, and all 3 surgeons gave him a different path to addressing the lower eyelids. And it's interesting because, I mean, I'm educated because I've been here for so long, but if I was a patient and I went to 3 different surgeons and they all gave, like you know, went through the array of options, it could be a little bit confusing for sure. And who do you trust, and who do you think is going to do the best job? It's tricky.
It's tricky. Well, the truth is that all 3 of those surgeons may have given different advice and all created a nice result with different techniques. So the surgeon has to use the technique they're most comfortable using to achieve the results that they're after.
That's a very good point.
So you could always, discuss that with patients, and everyone sort of picks and chooses which procedures they find work best for them, and also what causes the least risk to the patient. So I used to do almost 100% of my blepharoplasties with what was called a skin muscle flap, where I made a cut on everyone. And then over decades, I moved to doing probably 90% of my blepharoplasties from the inside with laser resurfacing or maybe a little pinch, just because I find the chance of causing distortion of the eyelid, which is sometimes very tricky and hard to fix, is way less. So that's kind of my sort of thought process on it.
Okay, so Rachel being in her, we're going to say mid to hovering towards the late 30s.
Well, let's just say mid. Let's keep it at mid for now.
Mid-30s.
We're mid-30s.
What can she do to maintain her beautiful looks? What do you recommend? Her treatment plan B?
I think our treatment plan needs to be comprehensive, including good skincare products that work with you. Good
Medical grade.
Medical grade skincare with Retin-A, vitamin C, and the other sort of medical grade ingredients that'll just help maintain your skin. Number 2 is sunscreen, which should be number 1. Sunscreen is critical because the UV radiation from being outdoors is going to be the ultimate ager for Rachel based on her lifestyle. So she has to wear a hat, sunscreen. She could even wear like sleeves and stuff just to cover up so you don't get tons of like photo damage on your body as well. And then energy devices to maintain her skin. Someone like Rachel may want to have a protocol or a plan every year to do a certain number of energy devices. So something like Halo, which is a Cyton laser, erbium laser, which is really good for maintaining texture tones of the skin. She could do a few of those years to combat the sun damage that she's going to be accumulating just being outdoors. Microneedling radio frequencies. All of those are something that she probably should do on a routine basis. And then just keep an eye on the other elements of her face. Make sure she's well volumized. She can do Botox just to prevent some of the crow's feet forming. A little bit of Botox in the center brow to prevent the 11s. Filler, I don't think she needs, but if she starts to develop any volume loss, she could always consider another fat grafting if she has enough fat, or filler or biostimulants. So those would be the things. Right now, she doesn't, in my opinion, need any other surgical intervention.
Yeah, not at all. Just to plan.
Just planning.
Just a plan.
That's a plan. So
It's a yearly checklist.
yeah.
Yeah.
All right.
Anyway, so I hope you enjoyed this episode of Unfiltered, and I want to thank Rachel for participating. I find these super helpful for patients who are in the same boat or considering procedures or just wanting to learn about what's available for patients researching aesthetic facial plastic surgery. Again, thanks so much for participating and being such a wonderful patient.
Thanks for having me.
You're welcome. And we'll be back with another episode shortly.